Welcome to our practice, and I've got something a little bit different for you. Today we're going to be focusing on a Pilates and a Yin mishmash, and there's actually going to be 3 parts to it. So the equipment that you're going to be needing are some blocks, and if you have a ball you can use a ball, or you can just have a towel or a pillow that you can like roll into a little bit of a longer thing, so you can use that under your back as well, and some blocks. I think that's all we need. So shall we get started? So we're going to come down onto the back to start with. I like to have a little cushion under the head, so maybe you do. Just see how that feels for you. And then as you come down onto your back, I just want you to first bring awareness to the lower back. So my knees are currently bent. Try with your legs straight, but if you find there's too much lifting in your lower back and it's not very comfortable, then have the legs bent, but have your feet wide and then just let your knees drop in so that everything can be nice and relaxed. Otherwise, you can have your legs straight, or perhaps put some blocks or a cushion under the knees. That can also help the lower back. So all I want you to do is just relax in this position. We're just going to start to bring, awareness to the body. How does the body feel? So bringing awareness to the top of your head. And noticing the forehead. So does it feel like your forehead is all scrunched, or does it feel like the forehead is nice and soft and the muscles are not working? Just allow your eyelids to soften rather than forcing your eyes closed. And notice what you're doing with your jaw. Are you clenching your jaw? And perhaps put a little bit of space between your back teeth. And you may notice that will help your lips, your tongue, and the neck to relax. Just giving your head a little nod from side to side, just allow any tension to melt away. Just bringing the attention to your shoulder blades. Do they feel like they're hunching up a little bit towards the neck? And perhaps just giving your shoulders a little ruffle around so that you can pull the shoulder blades down. And your hands can be out to the side, palms facing up. Whatever feels comfortable for you. Relaxing across the front of the chest, all the way to your fingertips. Just bringing your awareness to your lower back. We often hold tension in that area, so again, just give everything a little wiggle. Just let it go. Relaxing your bum cheeks down to your knees. And all the way to your toes. Take a deep breath in through your nose. And expand your belly. And then open your mouth and just let it all go. Breathing in through your nose, expand your belly. Open your mouth and let it all go. Just giving your toes a little wiggle and your fingers a little wiggle. So bending your legs, just bring your awareness back into the room, just softly blinking the eyes open. So we're going to use the ball. Now, like I said, you can use a cushion or you can wrap a blanket up or anything like that, but we're actually going to put this between the shoulder blades. And what this is going to do is really open up the chest. Now, for some people, myself included, you might prefer to put a block underneath your head, so that your head doesn't go too far back. Because I've got quite a long neck, so it's got a long way to go. So just lifting the floor a little bit takes some of the strain out of the neck. Again, you can have your legs bent or straight. And I want you to take the arms into a T position, somewhere around there. And I want you to bring your attention to the chest area and under your armpits and within the armpits. And at some point, with having your hands in this position, it's going to feel a little bit uncomfortable. So what I want you to do is maybe just find a little bit more discomfort. So unless you've had a shoulder injury or you've had a medical condition that's the doctor says don't do this, you want to find an uncomfortable position where the tissues are pulling, so you can feel that stretching sensation. So we're not after any pain, okay? So just be mindful of that if you have got a shoulder issue. And then relax. So these passive holds work more with the fascia of the body, this connective tissue that's throughout the whole body. Muscle has about 20% fascia, so we can work with fascia and still get results in the muscle. But this is just a very nice, kind and gentle way to help improve the health of your tissues, the health of your joints, and give the muscles this very gentle stretch without causing any injuries. And it's quite relaxing as well. So often most of us might be sitting on computers all day, so we can be quite tight across the chest, and that can cause these shoulders to round. So all we're doing is the opposite to that, and just opening up the front body. And then from here, when that discomfort starts to decrease, maybe you can take your arms a little further. You might also notice one arm can go further than the other arm. It's completely normal to have this imbalance. But see if you can keep your arms at the same height. And then just relax into it again. It can take 30 seconds, 40 seconds. Everybody's different. For these tissues to start to realign. And then that's when the discomfort starts to reduce. We're just waiting for that point. So perhaps in your body it has started to reduce. And maybe you can take the arms a little further. So remember, we're after discomfort, we're not after pain. This is a fantastic position to be in. If you find that your posture is becoming a little bit round-shouldered, maybe you've got some neck or shoulder pain. So if your head is on the floor, then you can kind of ignore what I'm going to say or just be conscious of it. If your head's on a block like mine, just be aware that you're not throwing the chin up. So almost think of dropping the chin slightly to the throat. You might feel a little bit of yickiness or horror. It's quite not that nice behind the neck. That's just giving your neck muscles a nice stretch. And we're just going to stay here for another few breaths. Perhaps you can take those arms just that tiny bit further. And the answer might be no. So this kind of release or this kind of stretch is best done cold, as it helps you not to get too deep into the muscle. Take a deep breath and expand your rib cage, pull that air down to your belly. And then exhale and let it go. Gently sliding your arms back to T position. Take your hands up towards the ceiling and just give yourself a little hug. Noticing which arm you've taken to the top. Open the arms into a T position again, and now we're going to switch so that the other arm is on top. Now bring your knees so that your legs are bent and your knees are hip width. Take your hands up towards the ceiling. And we're just going to start to introduce some movement within the shoulder joints. So taking the arms as far as you can without any pain, and try and keep those elbows nice and straight. Take the arms out to the side, down to your hips, and back up again. So we're in a bit of an arched position, that's fine. Just allowing all the front body to have a nice stretch. So breathing in for the first part. And exhale. Just focus on that shoulder, the whole shoulder moving. Breathing in, lifting the shoulders, and exhale, the shoulders start to drop down. And we'll just do one more. Breathing in. And exhale. Good. Take your hands to the back of your head, and you're actually going to use your hands to push the head up, to lift the head. Take the chin down into the belly, and then pop your weight onto your elbows and bring yourself off. And then we are coming onto the side. Oh, I've got an itchy nose. So we're coming onto the side. You don't have to have a block under your head. Some people prefer not to have one. I like to have one as it keeps the neck in alignment. But if you've got nothing wrong with your neck, then there's no reason why you have to have a block. Just move all the toys. So coming into side lying to face the front. And the arms will be open out to the front of you. And we're going to keep the hips nice and still for the first part. So take a breath in and take the hand up to the ceiling and hold it there. And then from here, I want you to physically turn your head and look at your top hand. So we want to keep the hips still, but we want to turn the spine. So I want you to think of sending your belly button towards the ceiling. And what will happen is the arm will just follow that rib cage. But keep looking at that top hand. So it's about 45 degrees, somewhere around there. What you don't want is your arm to be in that position. Okay, so see how close it is to the face, and this arm bone's almost like popping out. So pull the shoulder blade down and just relax that shoulder a little bit. So this wants to be nice and straight from the arm bone to the collarbone. So although this is called arm openings, I want you to think more of a twist of the spine. And the arm just follows what the rib cage is doing. So we're in that position. And then bring the arm back over again. And you might find the first one can be a little bit stiff, a little bit restrictive. So breathing in. Send the head, look at the hand, keep looking at the hand. Pull the shoulder blade, your top shoulder blade to your hips. And then think of a twist. You're going to twist your spine upwards. So think of your belly button going towards the ceiling. Now, some people are more flexible than others. But again, just be aware that if your hand is anywhere near the floor, that means your hips are moving. So we want to keep those hips nice and still. So if you feel like you want a deeper stretch, what I want you to do is just gently put a little bit of pressure in this top hip, almost like you want to push it forward, but not actively pushing it forward, we just engage in the hip. So as you engage that top hip, now think of that deeper twist. So use these obliques in your body. Keep looking at the extended hand. Breathe out. And then bring it back over again. Oh, lovely. I love Pilates. So inhale, take it up. Look at the hand. Exhale into the twist. And you might notice, like you can see with me, I've just gone a tiny bit further. Again, if that hand's anywhere near the floor, something's not right. The hips are moving or the shoulder's in the wrong place. Take a breath in, gently nudge your top hip slightly forward. And as you exhale, hug your tummy. Use those tummy muscles to help turn the spine. And you might find you can go a little further. And then exhale as you bring it back to the front. We're going to take this into a yin twist now. So breathing in, take the arm up, check the hand. And now what I want you to do is just let your hips go and allow your whole upper body to come onto the floor. I've got a wall there, so I just have to be a little bit bendy arm. So this leg is going to move now. Now, if you find it's too much, you can send your legs away or just take the top knee up a little bit more. And we're just going to stay here for 3 minutes. Now, you can turn your head to the left if you want to, or to the opposite side, depending what side you are, or just keep looking up towards the ceiling. So entirely your choice. So like I said, so we'll be here for about 3 minutes. Take a deep breath into the rib cage that is on the upside and exhale. The back of both the arms are on the floor, both the shoulder blades are on the floor. Think of length from the fingertips of one hand across your collarbones to the fingertips of the other hand. Just relax down your spine. Relax your outer hips and let go of your inner thighs all the way down to your toes. And just relax into it. Start to notice your exhales. Start to lengthen your exhales, so that the breath out becomes the longest part of the breath. Every now and again, just scan your body just to make sure that there's no tension creeping into your neck or your shoulders. If you feel like you've got some pins and needles in your hands, possibly there's just tight muscles in the chest, gently pressing down on the brachial nerve. So you're not doing any harm, it just doesn't feel very nice. If it gets too intense, you can always just move your hands closer towards your legs, your hips. And that can be an indication just to show you how tight those muscles across the chest are. If you feel like this has all the discomforts reduced, maybe you can go a bit deeper. You can always just tuck that top knee over the bottom one. So for me personally, it's a little bit too much. So we want to feel some sensations, but they don't want to be intense. They just want to be mildly uncomfortable. Mildly discomfortable. On your next exhale, just start to bring your head back to the center. And then hug your tummy in and allow the rest of your body to come back. Come back nice and slowly because it can be pretty intense. Always just taking your time whenever you come out of, especially yin yoga, can be very intense because you've been holding that position. So there's no rush to come out of it. Just let everything just settle for a moment. So just breathe into your back. And exhale. So we're going to turn over. I'm actually going to go the other way so I can be towards you. But you're just going to turn over towards the other side. And we'll start with the arm opens. Just get everything out the way. So heads towards the front of the block if you're using a block. Take the top hand up towards the ceiling, hold it there. Turn your head, look at the hand. Now keep your arm nice and relaxed, shoulders down the back. As you breathe out, think of turning your rib cage. Now I want you to notice on this side of my body. Can you see how restrictive my movement is on here? I have a really tight muscle in the back over here at the moment. It's actually going to do me lots of good. So you might find one side is quite different. But be aware that you haven't dropped the arm back and you haven't got your shoulder poking out like that. So the hand wants to be in line with the shoulder and the collarbone. Focus on your rib cage doing the twist. Your eyes stay looking at that hand, and then bring your hand back over. So breathing in, take the hand up, physically turn your head, look at the hand. Start to twist your spine, so think of sending your belly button towards the ceiling. And being aware that your hips are not moving. So if your arm's near the floor and it is straight over there, that might be indicating that your legs are moving. And just for the first part, we want those hips to stay stable. And you might notice the second one, even I can notice it, oh, it's going a little further. And take the arm back again. So breathing in, hand comes up, looking at the hand. As you exhale, sending the belly button towards the ceiling, actively drawing in those abdominals. Now, if you want to go deeper, I want you to think of nudging your top hip just a little bit forward, or just engage the hip as you hug your tummy in to turn a little more. If it's too much, you can just come back one step where you're not actively using this top hip. And then bring your arm back over again. Oh, lush. So inhale as you take it up. And then exhale. Nudging your top hip slightly forward. And then bring it back over again. And that is the last one. So now we're going to take it into the yin style. So take the arm up towards the ceiling. Now we're going to let the hips move so that you can bring both the shoulders and the arm on the floor. So you might be in that position, your knee might be further up. You can look towards your backhand or towards the ceiling, whichever one feels better for your neck. So because I'm a lot tighter on this side, I'm actually going to keep this top knee higher. So I can't go as far on this side as I can on the other side. And you really want to honor these differences that you have in your body. Because if I try to force my body to do what the other side did, I could potentially injure myself or break my back. It's that tight. So coming into the yin for this one now. So nice comfortable position with a tiny little bit of stretching going on. And as always, the tissues will give. Everyone's body is different, so you might find it gives quickly, you might find it takes a bit of time. But as soon as you feel that discomfort or the pulling sensations decrease or even disappear, at that point, maybe dropping the knee down a bit or anything you can to deepen the stretch, or for those of you that want to take that top knee over. And just relax. Breathing into your body. And on the exhale, let it all go. Think of length from your fingertips of one hand across your collarbones to the fingertips of the other hand. As you breathe into the body, notice how the ribcage expands. And on your exhale, just let any tension go from your hips and your legs. Everything's nice and relaxed with this gentle sensation of stretching or pulling that you might be able to feel. And begin to observe the exhale. Gradually allowing your exhale to become the longest part of your breath. This helps to reduce cortisol in the body. Helps to stimulate your parasympathetic nervous system, which is your rest and digest. So perhaps you could breathe in for 4 counts and exhale for 6. Every now and again, scan your body, make sure there's no tension, and perhaps just notice, is there a little bit of space that you can move into? Maybe you can go a bit deeper, but remember, this is not about forcing it. Yin yoga is about allowing it. Some days your body might allow it more than others, so remember, no forcing. After the next exhale, just bringing your head back to the center. Allow the hand to come up. And again, nice and gently. Ooh, that line is so tight. Ooh. So just stay there for a moment. Remember, we're not in any rush. Just allow your tissues to come back into a normal position. Like I said, sometimes coming out of the positions are actually far more intense than staying in it. But I do love how it feels in my body. So we're going to make our way onto the back. And again, you can have a block under your head or a cushion. All I want you to do is come back to the same position that we started in. So whether you had your legs bent or straight. And we're just going to go through that body scan again. And I want you to just be aware of the sensations that you feel. Does it feel a little bit more spacious across your chest and your neck and your shoulders? So breathing in. Open your mouth and let it go. Softening around the head, the jaw, the shoulders, down to your fingers, your hips and your toes. So really just notice how this feels around the upper part of the body. So to me it feels quite spacious, which is quite a nice feeling. Start to give your toes a wiggle. And perhaps have a nice big stretch. So just reaching and reaching and reaching. And then bring your knees into your chest. And just have a little rock from side to side. That feels delicious as well. You can either give yourself a little rock or just pop yourself onto the side and come into seated. Oh, that is so amazing. That actually worked quite well. So I hope you enjoyed this. The next part, which is going to be in another video, we are going to bring that attention down the body towards the lower back. So I will see you in the next one. Take care.